I just want to make sure we sort of get it straight onto YouTube, so everybody who's not here will get up and see it quickly. It would just save me the bother later. So just hang a sec. Wait a minute. Okay. Go ahead, Brunchelama. Is it Victoria? Are you unmuted, Victoria? Victoria, we can't hear you. Are you speaking? Victoria? I wonder whether she's disconnected. Hi, Victoria. Now we can hear you. Go ahead.
You can hear me now. Okay,
Yes.
fantastic. Sorry, I just plugged in my headphones. They have a little microphone.
All
Okay,
right,
cool.
go.
So apologies for that. Let me take us back. So basically, this is just an introduction to what guidelines are, where do they come from, and what do we do with them, basically. So the WHO defines a guideline as a systematically developed statement to assist practitioners and also patients to make decisions about appropriate healthcare for specific circumstances. I found another resource from America that was just described them as tools to inform decision making. And here in South Africa, we also refer to them sometimes as protocols and recommendations. It did seem like a bit of a gray area, but when I read further, the difference between a protocol and a guideline is that a protocol would have more weight or more sway under a medical legal situation. For example, if you did something that was not in the protocol or did something against the protocol, it is a bigger issue than if you did something that was different from the guideline. A protocol is supposed to be sort of the more stringent, and you should be doing this without, otherwise there should be a great reason why not. Whereas the guideline, it is, as it says, a guide. And there is a little bit more leeway with regards to individualizing things for the patient. So guidelines, sort of any group or person could make a guideline. However, WHO set out standards for it, and they have published a guideline with regards to how to make guidelines, ironically. But generally speaking, it should be approached systematically about, firstly, what are you looking at creating a guideline for? And then why do you want this, and what levels are we looking at? So are we looking at a guideline regarding the initial patient care, or is this a guideline regarding follow-up, or is it for a specific illness or disease? Generally, these guidelines should be formed with a committee with the relevant specialists from regarding that illness. So, for example, we're not going to have a trauma surgeon sitting on the committee for the diabetic protocol or guideline. Then from there, that committee and the relevant specialists are going to need to do a significant amount of data collection, be it from global or from national or from local or even from their own facility. For example, when we look at things like antimicrobial stewardship, those guidelines are often tailored down to the individual facility rather than from a national level. But the data should be collected and collated, and then the committee will meet back and they then have to reach a consensus about what is best and what would do the most benefit to the most number of patients from the data that they have collected. There are obviously then issues, there can be issues between patients, people not reaching consensus, but that seems somewhat above my pay grade, and it seems that basically you need to go further and find further specialists to have further discussions when I was reading through the WHO protocol. So the benefits for us of using guidelines is, and sort of the aims are to improve the general quality of patient care, and in turn reduce our morbidity and mortality statistics, as well as improving the consistency of care. So whether you see one doctor today and a different doctor next week, the aim is to try and have that there is a certain standard of care and that it is consistent across the board, so that it doesn't matter whether you see this doctor or that doctor, and that you're actually still going to get appropriate quality care. There were some limitations that I found in my research, and I think a lot of it is very relevant to South Africa. Perhaps not, well, not really with regards to HIV and AIDS, but in other areas where scientific evidence is actually lacking or not appropriate for our own demographic. A lot of these studies are based overseas or in a completely different demographic or socio-demographic area than we're working in here in South Africa. And sometimes drugs and other things and other resources may not be available. The second point on limitations was more to do with reaching consensus in the group or on that panel of specialists, because persons with significant clinical experience may have varying opinions between patient management and may have had personal, I don't know, like firsthand situations where they have found that a certain treatment or a certain medication works exceptionally well for their patients, and they believe wholeheartedly that this should be given to all patients. Whereas another clinical practitioner may have found the complete opposite. And at that point, you would have to then do further evidence gathering and further consensus managing. So either draw in further specialists to increase your pool of experience, or do actual research before including that in your guideline. And then the last point is more for a sort of socioeconomic background, and it was more about doing the best for the most number of people. And it's that sometimes for the patient themselves, they may feel that, or it may be that you're not exactly treating the patient precisely. But for example, if you're using some guidelines such as the INCI, then you would be treating, let's say, for example, a vaginal discharge syndrome, rather than getting a specific diagnosis. You're just doing a syndromic management. But the reason that that is there, it's to control costs and to be able to do the best for the most number of people again. Moving on, Boitumelo is going to be taking over. 1 second.
So now that we have an idea of what guidelines are and how they are made and how they're used effectively, we wanted to sort of share a guideline that is very relevant to treatment, especially in the primary healthcare sector. One that we felt was applicable to everyone was the standard treatment guidelines and essential medicine list. Because of the fact that it is can be used for primary hospital and tertiary care, and it is also available in adults and pediatric editions. The latest editions we could find are from the 2018 for primary healthcare level and 2019 for hospital level. I think most of us commonly know it as the EML guidance app that we have on our phone, which are readily available to assist us during consultations, whereas the others are available as books, as you would see them in either green or purple cover at your hospital or local clinic. So an example of how one could use this guideline and the way it is effective is that it has multiple conditions that are commonly seen. So if we were to use maybe one of our cases that we had today, where a non-occupational post-exposure prophylaxis wanted to be sort of applied to the 14-year-old girl who was requesting a TOP, one would just then page through the table of contents for things that you found relative to treating your patient, and then follow that guidelines according to what is stated in the book. And obviously if it's in the app, then you just search it in the search tab. So as Tori mentioned before, there are certain disadvantages to guidelines, and some may not always be fully inclusive of what you may need to treat your patient. Again, in this example, one that would be the antiretroviral treatment in our country, which is not detailed in the standard treatment guidelines and essential medicine list. And therefore, we just wanted to emphasize that it is important to then take on other guidelines that we have in the country to sort of supplement the care that you'd be giving your patient. And therefore, I'd like to also draw attention to the antiretrovirals guidelines, which were released in 2019 and updated. Also bringing to the attention of our colleagues that dolutegravir is now part of our regimen, and that it would be a great idea to just go through the guidelines go through the guidelines and sort of update your knowledge on this new drug, relatively new drug, and its side effects, and who would basically qualify for a change in their regimen to dolutegravir. Then we just wanted to, the take-home message is that guidelines are guidance for management of the conditions we see almost each and every day. And the standard of care then becomes uniform in primary health care, in hospital and tertiary level. And basically what is done at primary health care then helps the person at the hospital level to not start over when they see a patient, but rather continue the care. And we thought that the overall effectiveness of a guideline will depend on whether it's applicable to your population. So taking into consideration that you're a third world country, taking into consideration the resources at your community healthcare centers, and as Tori also mentioned, that sometimes drugs aren't necessarily available in our country as they are with other guidelines that we may be using that are international. It is important that guidelines are updated regularly as to include drugs that are newly added or new research that has found better treatments. And it also needs to be easily accessible. I'm sure a lot of us have seen that the essential medicine list and standard treatment guidelines, the book itself is not always available. So to have the app easily accessible on your phone sort of makes it quite a good guideline. And the ability of the health practitioner to fit the patient profile so that they know exactly what to look for in the guideline that is applicable to taking care of their patient. That is that from us. And our next slide just includes all the links to the guidelines we have mentioned, including the sort of newly updated antiretrovirals clinical guidelines.
And last slide is resources.
and just sorry. Thank you, Prof.
Thank you very much. Really appreciate that. I think, are there any comments, Dr. Aki, Dr. Petkova, Dr. Manda, or anybody else? If you want to add any comments to this. Okay, while I'm waiting, I just want to mention that please understand that guidelines are there, they're national, international. But what you need to do is in your facility, in your practice, in any spaces that you're in, you need to constantly try to pull out of that guideline and create protocols that help you to make choices even in your facility, because that is how you devolve it to make it really suitable to your needs. And you might pull from different guidelines to say, in my practice, I will do it. I think the question of attending to evidence is quite important, and also the rationalization of care for the population is quite important as well. So I think that's quite often, and I think the standardization of care. So it's quite surprising that there's so few studies that actually spell out adherence to guidelines. In the main, doctors are very bad at following guidelines. And in fact, the question of the quality of care is a very variable and not something consistent. Any other comments? Dr. Aki, Dr. Petkova, Dr. Manda. Okay, no comments. We can stop at this group. The next group, I think, will be presenting shortly. It's between Luca and Amma. Going 1, going 2, going 3. All right, I'm going to stop the